This is Dr. Richard Balikian from Balikian Plastic Surgery discussing our comprehensive artiste lift. An important component of that is a subnasal lip lift. So our lip ages just like everywhere else with gravity, where it lengthens and goes longer and longer and longer and longer, and the pink part of the lip starts rotating in. So what does that look like? That looks like somebody who has too long a skin here. Every time they talk, you never see their teeth because the lip is covering the teeth, and it just gives this subtle cue of aging. So if we do our artiste lift and everything looks great, but you still have a long lip, something is just off. And again, what is my goal? To have a harmonious result, an artistic result that looks balanced and pretty and doesn't draw attention to itself. So what do? We do a subnasal lip lift, not to create a voluptuous lip, but to put everything back in balance. Now, a traditional lip lift is an incision underneath the base of the nose here, cut out a few millimeters of skin, stitch it together deeply, and stitches to the skin. But the problem with the traditional lip lifts is they go too far up the corners of the nose, and they don't have enough support under the skin to support it, so that scar ends up looking thick and ugly and almost like railroad tracks. So we've fixed that by switching to a deep plane subnasal lip lift. What's the difference? The difference is now we still make the incision underneath the nose, but we don't have to go all the way up the sides. We can really hide it where no one will see it in any pictures. Once we go underneath and remove the skin, we don't just leave it there and start stitching it up. We release the rest of the skin lip off the muscle so that it can roll up gently, curl up the lip slightly, shorten that lip, and we can do deeper stitches that really support it up so there's no tension on the stitch lines. When we do that, we get an impeccable result, and we can also balance out asymmetries. Some people have one part of the lip lower than the other. The beauty of the way we do things is we're not just going to take a uniform amount here and keep those asymmetries. We're going to try and fix those asymmetries too. And that's a really critical part of why a consultation matters, right? It's great to have all this information and think, okay, this is what I need, but there's still artistry in the diagnosis. And that's why I love spending time with my patients during the consultation to hear about you, hear about your goals, hear about the things that bother you, see pictures of you when you were younger, and come up with a bespoke plan for you. That's what leads to a pretty cupid's bow, a beautiful lip, and one that looks very natural with the rest of your result.